with the same speakers. I'm working for the healthcare industry, and I'm not Dutch. I speak the same language as the Dutch, but I'm Flemish. In fact, in the 16th century, when the Spanish invaded Belgium, which is called now Belgium, we were the Netherlands, and so the artists and intelligentsia, they left, and they were left to the Netherlands. So maybe I'm Dutch then, or maybe the Dutch are more Flemish. So anyway, enough 23 years of experience. I will try to reflect from the team and myself in 12 minutes. I joined, in fact, industry 23 years ago, directly from kindergarten as a scientist at Janssen, J&J. Working as a scientist in the discovery and the development of the first generation of HIV drugs. And when one of our friends came back from Africa who got infected with HIV, we tested his blood, his virus population against different drugs that we were discovering, but also drugs that were on the market. We were able to, with the phenotypic information, help to craft a better cocktail for him. And he got better, and that was in fact the whole idea of Verco, a spin-off company of a company called Tibotec. And I left J&J then after 5-6 years because there was no interest in biomarkers and diagnostics at that time. And in the meantime, we have been able to help 650,000 patients with genetic information and phenotypic information, probably one of the largest databases on viral resistance on the planet with outcomes information. And that information helped to develop better drugs, 3 new drugs active against those virus strains. So a few years ago, in fact in 2002, we came back into J&J, and so if you want to remember at least one lesson today or from my presentation, never burn your bridges because your previous boss can be your next boss. And in 2002, we came back into J&J and at Janssen, and we set up another group focused at companion diagnostics development, but also 3 or 4 years ago, we saw, in fact, a fantastic sister company within the corporation, Verbiest, focusing on circulating tumor cell with the platform on the market Cell Search and working on a new platform to enumerate but also characterize CTCs. A lot of similarities between HIV and also oncology, and so that's the reason why we said let's think about bringing all these great minds together, and that was in fact the inception of Janssen Diagnostics, focusing on really on developing companion complementary diagnostics and also a strong focus in oncology, but also supporting any other of the other therapeutic areas. So within J&J, within Janssen, we realized that we have been successful and as an industry in drugs and diagnostics, but I think we need to work on a new model to provide a total solution to the patient. It's about early diagnosis, it's about the right platforms to develop, it's about targeting the right patients, and it's also about personalized medicine. And so that's where we come in within the Janssen group, with Janssen Diagnostics, a group of diagnostic experts taking care of all the whole discovery, development, but also the market access for diagnostics. So we have, although we have been good as an industry, I think it's time for change. And now you all have this device with you, a smartphone, but in fact it used to be 5 or 6 different devices not long time ago, and now the whole market has changed dramatically. And we as a healthcare industry, we have to also to move and change and to go more into integrative solutions. And like the lately founder of Janssen, Dr. Paul Janssen, was always saying, we need to move on, patients are waiting. So that's what our slogan also reflects, that we take your health personally. So a few, with that, that's in fact 23 years of my professional life, but some reflections. I think diagnostics really make a difference in personalized medicine, and you see different components here in the continuum of a patient, from early risk diagnosis up to disease staging, response, adherence, monitoring disease, and we know that in fact diagnostic information will definitely enable more efficient use of healthcare resources. But how do we define, and how do we realize then the potential of value? And I think some of the topics came up already this morning, but we're a lot stuck on a product level. We always look very narrow per product and never look at the whole flow of the continuum of the whole solution. And it has been thought why it is because we try to assess and define the value very because we're stuck in the old way of thinking, and think the courageous testimony of the patient, Peter, this morning even mentioned it. We are stuck with very old model as a healthcare industry. Not only the healing industry, but also the healthcare system as a whole. What is also at issue is we have a lot of discussions about evidence standards for personalized medicine diagnostics to demonstrate value. A lot about these topics, that clinical, analytic, validity, clinical utility, but it's a lot about the what, but the how. How do we push now more for evidence standards for value? And that is more, much more, and I think the whole team today really made it clear, that's much more the real question. But it's difficult. And a few considerations and pitfalls, because we're also, the topic today was mainly about oncology, but we work also in ulcerative colitis, in cardiovascular, in infectious diseases, so it will be different if you look at different diseases. The value of clinical information is very important, becomes in different aspects, and may not always be appropriate as a single standard. And then the cost of establishing clinical utility, we have to take that into the whole development, and it's also the lack of return on investment for the diagnostics in the current environment remains a real challenge. So the consequence is, in fact, do we stifle then innovation, or it's a dilemma. And just a quick side comment here, it's the whole thing like antibiotics now, and targeted antibiotics and targeted diagnostics. It's a chicken and the egg, and we have to get out of this, and the only way to get out of this is to really to have an open forum and an open discussion with all the different players to really to establish the right thresholds of evidence. And it's industry, it's consumers, it's payers, it's the whole industry, drugs, diagnostics, information, electronic medical records providers, patients, and that's what we saw, in fact, that I experienced myself in many of the discussions we had in HIV. We really had pushed forward the field dramatically by sitting down with all the stakeholders and really pushing the way of treatment. And the drugs were very expensive at that time as well, but by pushing really, the drugs have to make a big difference. We were able to make a second and a third generation, and now it is, if you have access to the drugs, has become a chronically manageable disease. So just to start more on the concluding comments. So we have to envision a new way of how to valorize and how to assign value. And so we have to, I think, creating a more healthcare environment where we incentivize diagnostics, new and innovative diagnostics. And there it's a combination of innovation, not only in industry, but also academia, and not only to have transparency for industry, but also transparency of academic diagnostic solutions. So it has to be much more broader. Also an integrated framework of understanding, regulating and paying for drugs and diagnostics and also its long-term value. So it's not just we're really looking at the transactional way a lot. We have to look in time whether you bring value, whether you can bring outcomes to a patient. a validation process much more comprehensive than now. And then tracking outcomes, as I said, we are used to, I mean, if you buy a software, you have software updates. If you buy a car, you do a maintenance on your car. We have to track much more what we do in healthcare and track the outcome for citizens and patients in the end, and in the end assess the value downstream. So you have to have a system to look at in the time and be able to look back as well. And then, as I mentioned briefly, I mean, what we saw in the microelectronics and in smartphones, there is a complete new business model that we have now. We have to think differently in healthcare and also think about new business models and come out of the current paradigm. So just to finalize, I think we have a great opportunity to bring more convergence between drugs, diagnostics, information, and most of the discussion now has been a lot about companion diagnostics, and then also, in fact, more and more complementary diagnostics. But where and it came up a few times also today, we are spending. I mean, the US, the expenditure per patient per capita is 90% going to the last 2 years of a citizen, and only 1 to 2% is going to prevention. So we should try to shift it and really think about how can we go more into early diagnosis and go to disease interception and shift the model and put more on that emphasis. And I think that is where as an industry we are really moving more to that paradigm. And personalized medicine, precision medicine, I see that as a tremendous learning step in going more into the disease interception ultimately. So this was 23 years of my life and some reflections. So thank you very much.